Welcome back to the show, folks. We're on the phone here with Senate Majority Leader Harry Reid of the great state of Nevada, here to talk to us about health care. So we'll plunge right in. Senator, welcome back. It's good to have you. Why don't you start by telling us how you're feeling in terms of this legislation? You know, what's the sense of where we are today?
Keep in mind, it's approaching $1 trillion. So I am very, very happy.
Well, Senator, I don't think that's something really to laugh about. I mean, this money comes from the hard work of men and women who are struggling in this economy. I hope that the Senate's sensitive to that.
I would only add, we talk about cost competitiveness, but the one thing we fail to talk about is those costs that you don't see on the bottom line.
Wow, Senator, that's very troubling. Are you saying that this is going to cost even more and that there are costs you're hiding from the American people?
Pardon me?
Well, I mean, you will force people to pay for all those costs you say you're not revealing to them.
Well, I don't accept your phraseology. I don't think we force people.
Well, people will have to pay or go to jail or get fined.
Well, no. In fact, quite to the contrary. Our system of government is a voluntary tax system.
Oh, so you can opt out of paying for this health care. Okay, well, what happens if I choose not to pay?
He's subject to civil and criminal penalties.
Okay, then we are paying for it through taxes. All right, let me ask this because it's also come up that you will require people to have health insurance, or you can face heavy fines and even go to jail.
You don't go to jail. Some people go to jail. There are all kinds of civil penalties. If you don't pay your tax, you pay interest and you pay penalties. The fact of the matter is, our system is a voluntary system.
All right, then you can understand why people are so outraged.
I really don't understand what you're trying to get at here.
These individual mandates, they're making people really angry.
You can't dance if your partner is unwilling to get off the chair. It's like when I was in high school. I wanted to dance, but she wouldn't get up.
I don't even know where to go with that. Let me play a clip of the president here. Much has been said and written about the fact that you will not be eliminating employer coverage. You say that the public option will be only one of the options, right?
I believe one option should be the public option. I've always believed in it. I'm going to work very hard to see what we can do to have this in a bill.
Okay, but let me play a clip from the president. Here it is.
I happen to be a proponent of a single-payer universal health care plan.
My commitment is to make sure that we've got universal health care for all Americans by the end of my first term as president. But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
Okay, so he seems to suggest there that his intention is to eliminate employer coverage, even though he regrets he can't do it immediately.
The president's losing his own base on this.
Wow. Well, that's a very candid admission. Folks, you heard it here first. Senator, I agree people are really going to be mad about this. They especially don't like the idea of those death panels. I mean, who's going to be making our health care decisions, and what are they going to base those decisions on? I mean, we've seen what the president has done with those czars of his.
He's set up an empire. He's the king of the empire, and he pretty well does whatever he wants to within that administration.
But don't you think he's breaking his promise to the American people by doing that?
Well, it may be too late for him to keep this promise. It's not too late to start with this issue of abortion. Maybe.
All right, well, I'm glad you mentioned abortion, because this is another area where we're...
As a pro-life senator.
Oh, now, Senator, let me stop you right there, because you are supporting the taxpayer funding of abortion outright. I mean, that is really incomprehensible.
Makes no sense.
Thank you. No, it doesn't. I mean, whatever your view on abortion, whether pro-life or pro-abortion, I think we all have to agree that you can't force people who believe life begins at conception to pay for other people's abortion.
Well, I don't accept your phraseology.
All right, then how can you explain it?
I want everyone just to cool the jets. So everyone just relax on that issue. I don't know what more I can say. That's how I feel.
Well, Senator, do you see any problem with this bill?
In the summertime, because of the high humidity and how hot it gets here, you could literally smell the tourists coming into the capital.
Okay, I don't understand what you're saying.
47 million Americans have no health insurance.
So what you're saying is that those 47 million people who have no health insurance, they stink?
Maybe.
Really?
The question is, do I trust Senator Lieberman? The answer is yes, I trust Senator Lieberman.
Well, Senator Lieberman opposes this bill at the moment, and he's worried about all the spending.
Coal makes us sick. Oil makes us sick. It's global warming. It's ruining our country. It's ruining our world.
All right. This is getting a little weird now. Let me just ask one more question. Senator, what do you plan to do if you continue to experience this opposition from the American people?
Unlike a lot of things around here, if you don't get your way, you kind of throw a tantrum a lot of times. So I would throw just a little tantrum.
Well, all right. That's how Washington works, I guess. Senator, appreciate you being with us for this segment. Folks, we'll be right back after the break. Thank heavens for clock.